Morning.
Good morning, Tom. Go ahead.
Thank you all for joining us. Appreciate your time this morning. I will give just a brief overview of Health Docs, who we are, and kind of what we do, and then we'll get into it. Health Docs is been in business a little over 25 years now. We are based out of Phoenix, Arizona. We are an international organization with a presence in almost all 50 states and a couple of foreign entities as well. When we began our company, we had essentially a single product, which was our policy management system. Over the years, at the request primarily of clients, we have developed now 12 products that we have that are focused on the governance, risk management, compliance side of things. We are very active with, you see here, ASHRM, several hospital associations, including Kansas Hospital Association, Texas Torch, and others. You see here that we have embedded AI into our system now, which is created a lot of interest in what we do. So that's kind of just a real quick overlay of who we are and what we do. I am going to back out of the way here a little bit and let Haritha take over, and she and Rupa will present for you now.
Thank you, Tom. Thanks for the introduction. So today we will be talking about our OCR enforcement, and the topic is about HIPAA physical safeguards. We had also been talking about the other HIPAA series of topics. We had covered HIPAA, the regular overview, HIPAA BAA, HIPAA administrative safeguards, and so on. So you must be aware of OCR, right? Enforcements. Recent trends and penalties and lessons learned from OCR enforcement actions are captured in our agenda here. And then in the key physical safeguards, we will go over what the physical safeguards are, which are the first line of defense for protecting any sensitive data, especially in our healthcare environments, which is what we cater to. And these also include like facility access controls, which all of you would be having access key, right, to enter your facility, workstation security, and the visitor tracking, and so on. We'll also discuss examples on how the badge controlled access, surveillance systems, and the secure disposal of PHI is so important. And how we emphasize on digital protections, right, where physical vulnerabilities can lead to major compliance breaches also. So we have AI-assisted protection, as Tom mentioned. Even at Health Docs, we help with these services, and in various ways. AI can be embedded in any area that we can think of, and it makes the decision making is much easier with AI, right? It is an assist, just like how ChatGPT assists you. AI helps you and assists you. We are not saying it can replace humans at any point of time, but it can assist you during the process. And also the security programs, how so robust security programs align with people, processes, and technology, and what the key components are in this process is what we'll be covering today. And you can use the chat window to ask any questions at any point of time, and we will answer the questions at the end. So let's go with the first poll. Let's launch the first poll, please. Here you go. So did you know that OCR has imposed multi-million-dollar settlements for physical safeguard failures? For instance, if there is stolen laptops, facility breaches, and so on. So go ahead and take your poll. Okay, thank you. Thanks for taking the poll. We see that 75% are aware of the several cases, and then 25% have heard about it, but didn't realize about the penalties being that significant. Okay, thank you. We can close the poll. Okay, let's move on. So this is the OCR that I was mentioning on the highlights. So let's take a look at the recent OCR enforcements, right? 2025 did see a significant surge in these OCR enforcements due to a lapse of the physical safeguards. And so most of you are aware of this, right? So the costs, the penalties are significantly high. Just to name a few, like it's about $650,000 for a lost laptop, which is a big deal, right? And then the stolen backup drive without encryption, which is actually a significant miss on the IT side. So that is much higher. It's about 800K. And if there is any improper media disposal, it accounts for like $1.1 million. So this is clear that if an incident was preventable by physical means, the penalties will be severe. So what is the key takeaway here? So what we learn is that compliance costs are far less than corrective enforcement, right? So if you go ahead and implement corrective solutions, then that really helps you significantly save your name brand also. So we'll have our next speaker, Rupa, here.
Thank you, Harita. Thank you for setting up the context and also helping us know the recent OCR penalties. So from that itself, we'll know how important is even the physical safeguard. So not only now we cannot say HIPAA violation is only like you are getting exposed or it's a hacking. It's not just hacking is a HIPAA violation. Nearly 25% of healthcare data breaches are still coming from physical security failures. Could be lost devices or it could be unauthorized access. Even there are many cases where paper records were left in open areas, the patient related records were left in open areas. Those are all a high risk, and the data breaches are coming from these failures, mainly the physical security failures. So that's why physical safeguards still matters most. And in 2025, OCR continues to stress even on physical security during audits. So it's not just as an afterthought, but the OCR is enforcing as a core safeguard. So HIPAA security rule requires that we protect where EPHI lives and moves physically. That means whether on devices or servers or even within a hospital corridor, if this EPHI lives or moving physically, then the HIPAA security rules enforces that we take care of this physical safeguards. So physical safeguards are no more just a kind of just a secondary one, but it is our first and last line of defense. So they not only protect against uh, human tendency of forgetfulness, but also it helps us to protect from real world exposure. So let us look at what are the objectives of these physical safeguards. This mainly we can sum up into 4 simple objectives, calling it as starting from protect, control, exposure, and prove. So these are all not just compliance terms what I'm using, but they're actually the practical cycle of keeping this patient data safe and secure in the real world. So let us see what is protect. So secure your locked server rooms, restricted zones, and proper device storage. All this goes with starts by securing this environment which is in the hospital. So if let us assume that if someone can walk up and see your PHI, then even whatever the strongest firewall you have will not save you, right, from the breach. So the goal here, when I say protect, is to build the physical barriers around our data. So controlling is next is the control. So limit access to only for the ones who actually needs this data. I mean, who actually needed in the hospital, this data is required, PHI data is required. So always try to use ID badges, role-based permissions, and if any staff leaves from the organization, try to quickly revocate their access permissions. So the main goal by controlling is reducing unnecessary exposure of any human access by mistake. So not only protect and control, but you also have to track who enters or when they entered and why they entered. That is nothing but monitoring. So use access logs, cameras, or even nowadays everywhere you hear AI, right? So you can even use AI to detect unusual activities in the campus. So the main goal is to catch problems before they become breaches. So lastly, finally, it is nothing but proving. So how will you prove all these are working fine? It is nothing but by documenting your safeguards. So you should have access logs, proper training records are maintained, and any device maintenance reports. All these are required even for the OCR audits. When OCR audits happens, you have to show the proof of this protection. So all these can be summed up and divided into four main standards like facility access control, workstation security, device and media controls, and maintenance records. These four becomes core physical safeguards. So you are not just looking at these four physical safeguard as just a guideline, but it is a standard. That means it is a regulation, you should follow it. So this is where the modern tools like even AI powered CCTV analysis are changing the compliance from manual to proactive. So use that the modern technology to make more proactive actions. So you can summarize this all these four physical safeguards into identifying. First, we have to identify which are those devices where actually our EPHI exists. So always when we say it's a hospital and EPHI physical, we say it is EHR. But often we overlook places like laptops. It could be even sometimes mobile devices, email, cloud storage, and even third-party vendor systems also can be one of the physical safeguard what we need to protect, because we we will look at we will overlook at these most of the times in our hospitals. So also look at the vulnerabilities. You can include examples like if the device is lost or stolen, or there could be weak or shared password, there could be insider snooping. So every step matters. So this step sets the stage. So because you cannot protect what you don't know you have, so identify becomes the first step. So once you identify, go and analyze. So once you analyze where this PHI and what could go wrong, and assess the likelihood and impact of each of this risk, go ahead and try to identify the mitigation actions. So once you identify the mitigation action, implement those mitigation actions and also review periodically. So risk analysis is not just setting up and forget it, that we analyzed it, we implemented it and just forget it. No, don't do that. So please review in a periodical basis. So when once safeguards are implemented, you have to check whether they are working or not. So for example, you might have introduced the MFA, so you need to check whether staffs are actually using it or not. All those things you need to verify. It is not just writing a policy, but the implementation is key in all these safeguards. So let us try to understand each of these four physical safeguards. So let us focus on facility access control. So facility security is about managing who can enter, where, and when. So the key is zoning. So restricted areas like data centers, nurses stations, record rooms. So all these needs MFA. You all might be knowing the multi-factor access and surveillance is very key in all these zones. So every entry, even by authorized staff, should also be logged and reviewable. So hospitals, what happens is that majority times in OCR audits, so they find that hospitals are not regularly testing and documenting these access protocols. So that is the main failure what majority times the OCR audits will show up. So even doors might be having logs, but that is not sufficient, right? So unless you document what is the access protocols, so how regularly you are testing your safeguards, it is not enough. So use some modernized tools like badge tracking, even biometric access or camera-based verification. These things are very much required when it comes to facility security, so that you can protect your physical area. So you all might be knowing this device management, laptops, tablets, media, they are the portable device, right? They have a huge vulnerability because they hold the PHI and traveling outside the facility, because these devices we in day and day out we carry outside the facility, and they are prone, they easily can be lost, right? So every lost and stolen device must be treated as a potential breach unless proven it is encrypted. So create a clear chain of custody, who you are issuing, what is the use and how it is transferred and how the device has to be disposed. So those things needs to be clearly documented and implemented. Always try to encrypt, auto lock and track every device, maintain a digital inventory. Okay, so always train the staff, immediately report if there are any misplaced devices. So this definitely, so reporting this itself will save a lot of organization from lot of fines. So the key takeaway from this device management is treat every devices like your medical asset.
Okay, we are here. Thank you, Rupa. We are on the next poll. Let's launch it. How often does your organization conduct facility or device security walkthroughs to verify physical safeguard compliance? So is it quarterly, annually? Is it only after an incident has occurred, or you're not aware of it? Okay, so yeah, 50% say it's quarterly, 25% say annually, and then yeah, 25% are not sure. Yeah, it's the IT side that does that, right? So, okay, we can close the poll and move on.
Thank you. But awareness is very important, that these awareness plays a key role in protecting our safeguards. So let's move on to the next physical safeguard, which is nothing but workstation. So let us understand what is workstation security and what best practices can be used. So workstations are the most common point of unauthorized PHI viewing, right? You all agree with me, right? So there you will have to implement a simple practices like privacy screens, but it is very simple, like as simple as automatic timeouts to your workstation, and proper workstation placement, and always use the clean desk policies, because these will definitely help you in a longer run to keep your workstation secure. So regularly audit shared terminals, especially you all are from hospital background. So especially nurse stations, triage areas, regularly audit those shared terminals. The OCR expects not only the policies, as I'm telling from the beginning, but OCR expects you to provide evidence of these enforcement actions. For example, you could even provide the photos of compliance setups, or staff training logs can be one of the evidence. So visibility is equals like a vulnerability, right? If something is visible on your workstation, then there is a high chances it is vulnerable. So always keep EPHI out of the view from anyone who is not required to see those PHI, right? So, and the fourth one is the access control and accountability. So this ties what is the physical access to individual responsibility. So every access badge, login, or room entry should map to a named individual. You cannot just use it randomly. When multiple staff share generic credentials or swipe cards, so then its compliance can easily break, right? Consider layered logging like physical entry and plus digital login correlations. So these will enable fast forensic response during a breach also. So this is how you can protect through access control and accountability. So, and integrating AI in this physical safeguard plays a key role. You could even use the AI assisted protections, like by using a real-time anomaly alerts. So now AI supports predictive monitoring, right? Detecting unusual access patterns, or after our entries also automatically can be detected using AI. So smart cameras can flag tailgating or prolonged door openings. So the AI can help you spot these kind of anomalies. So integrating AI with access logs definitely helps security teams move from reactive investigations to actually real-time prevention. So early adopters are seeing definitely this reduced incident rates and faster response time. So there is a myth that AI is replacing the compliance officer or human beings. No, it's not replacing. Actually, it's making them proactive protectors of our safeguards. So I have a small case study where actually a mid-sized hospital has lost an unencrypted laptop. It's just a laptop, but it was unencrypted, which contained 10,000 patient records. So Harita was in the beginning, she was showing lot of cases, right, where OCR penalty was imposed. So in this case, actually, the device was actually taken from a physician's car, but where there was no tracking software also installed on that laptop. See, it's a small mistake, but it resulted in 850,000 settlement, and OCR has mandated 2 years of monitoring by OCR on that hospital. So root cause, when they did the root cause analysis, it was really surprising because the root cause was not really hacking. There was no hacking instance, but actually it was lack of encryption and also weak physical controls. There was no controls or security involved in that carrying the laptops. So these cases reinforce that HIPAA violations are often actually preventable with basic physical care. So I can say, just imagine $1,000 laptop had costed them $1 million breach because it was unprotected. So that's why the physical safeguards are also very important, and the today's compliance landscape of healthcare is also telling us that in 2025, so these major HHS and NIST, all of them has brought some major shifts from uh, directly, which is affecting how we manage privacy and security programs from the old method to the new one. So HSS, and I have some real quick update for this year. HSS and HIPAA is tightening enforcement around risk analysis, device management, and physical safeguards as well. They are focusing not only on whether policies exist, but on how well the policies were implemented and monitored. So this having the policy is no more enough. So you need evidence of execution of those policies. So NIST guidance alignment is also happening, which is Cybersecurity Framework 2.0 and updates to SP 866. They are mapping directly to HIPAA requirements. So which means organization can use NIST as a practical roadmap to strengthen their HIPAA programs. So how we can modernize these HIPAA security programs? So HIPAA has been, now we all know, right? So HIPAA is not new. It has been around for over more than 2 decades. But the threats are not same. The threats what we are facing today is not looking like what was there in probably 1996, right? That's why modernizing your HIPAA security program is not about just rewriting the rule book, but it is about rethinking how you can make it operationalize. So modernizing HIPAA is not, as I mentioned, it's not just rewriting the rule book, but making them smarter, faster, and more adaptable to today's threats. So use these 4 steps: assessing, alignment, automate, and audit, so that you can modernize in each and every aspects using this. So start with a clear-eyed review of your current safeguards. That is nothing but assessing. So by assessing, you know your gaps. Once you know your gaps, connect with modern standards, that is with HIPAA controls to NIST or ISO 27001. So once you align or once you connect with your modern standards, try to automate. Move from reactive to proactive, because automation can definitely help you track your devices, monitor access, and flag anomalies, so which reduces manual errors and speed up the response also. Once assess, align, and automate is done, please be ready anytime to audits. That means keep your digital records, logs, monitoring reports organized so that you can be ready anytime. A modern program can prove compliance instantly by using these 4 steps. And lastly, we need to make sure ongoing protection and accountability by implementing a real-time threat protection, and keep regularly training your staff on security protocols. So it is not, protection is not one-time setup, but it is always ongoing. So your physical safeguards need regular monitoring, and it needs updates and testing to stay effective. And always accountably requires visibility, which means track who accessed what, when, and why. Logs and audits make this possible. Okay, so people, process, and technology, all these things should work together. You cannot work in isolation. People work in isolation with the process and technology. No, it should not be happening that way. So build a culture of accountability to maintain this ongoing protection. So encourage staff to follow best practices and report issues promptly. And I would say continuous protection and clear accountability will give you long-lasting HIPAA compliance.
Thank you, Rupa. So here at Health Docs, we have an all-in-one GRC solution suite that also includes the HIPAA risk methodology and identification solution. So it automates several things. It looks at your enterprise risk, HIPAA risk, and then incidents. It looks at your incidents and uses AI. So AI is ready when you are, right? So if you want a non-traditional version, you can use that in the beginning, and then you can include the AI aspect of it when you're ready for it. So it looks at your current scenarios, current breaches, and predicts the future so that it helps you automate and physically protect you from all these safeguards. So thank you all for joining. We will look forward to the next webinar and keep in touch. So we'll be in touch through newsletters. Thanks again. Bye-bye. And here is our contact slide. If you like to connect with us through different means, you can take a picture of this if you need to reach out. Thanks again.